Okay, number 12, we're going to talk about depression and anxiety. There's a mental health crisis in this country, partially because the go-to treatment for depression is a little bit better than placebo. Right now, we got 17% of the population taking antidepressants. A lot of what we do is backed by research. A lot of it doesn't make its way into medical journals because of the influence of the pharmaceutical industry. And what I'm trying to do here is create a Dr. Seuss version of natural health care. This is one way of doing things. It's not the only way of doing things. If you have an extensive background, you probably have some ideas that might not even be presented here. But this is a good way to get started. I'm going to talk about Zorex a lot because Zorex isn't found on Amazon, and I really don't want lay people treating themselves with the information on this tape. So for minor depression, the antidepressants, the SSRIs are not much better than placebo. Benzodiazepines, things like Valium, Xanax, Halcion, things used for anti-anxiety, have no positive therapeutic role. Here's another study that says the same thing. SSRIs are marginally effective, not much better than placebo. SSRIs are linked to violence and suicide. And I don't want to get into the gun debate too much here, but if you think about it, we've got these mass shootings going on. And up until 1988, that's when Prozac was invented. Did we have as many mass shootings? I mean, like the crazy kinds that we've been having? Probably not. And Americans have been armed to the teeth for their entire history. Also, if you look at things like bad behavior on airplanes and things like that, there seems to be much more of this. It's like people are wound a little tight. The pharmaceutical industry argues that, 97% of the people don't have a problem when they take these, and that may be true, but there's 35 million people taking them, which leaves 3%, which is about a million people that are probably walking around out there ready to snap. And this needs to be looked at more closely. Unfortunately, it probably won't be because the pharmaceutical industry does most of the medical research in this country. And here's another reason why I don't think lay people should be following the information here. You need to get help because if you're on these things, withdrawal can be very unpleasant. You get flu-like symptoms, vivid dreams or nightmares, nausea, dizziness, burning, tingling, shock-like sensations, paresthesias, mood changes. It'll begin in 2 to 4 days without the drug, and it might last for several weeks. So if you want to transfer somebody over to a more natural way and have them stop taking these, you need somebody with a medical license to help wean them. And like all chronic disease, inflammation is a component of depression. And it can be argued that the brain is especially prone to inflammation because of the high lipid content. Also, researchers have found that high CRP levels make patients less responsive to the traditional treatment for depression. Interestingly, since we're dealing so much with cognition problems in older people, high levels of CRP is also associated with cognitive impairment. So, a lot of the research lately is centered around looking at inflammation with respect to brain function, in other words, depression and anxiety. And researchers have found there's a strong correlation between inflammatory markers and depression and anxiety. High C reactive protein, high interleukin 6, high TNF alpha. And the authors of this particular study says that the problem might be lifestyle, which, if you think about it, 35% of all Americans are walking around in an inflamed state. So something as simple as changing diet will have a big effect on depression. Inflammation causes disruptions in the blood-brain barrier as well as structural changes in the central nervous system. It decreases neurogenesis, which is repair, and causes glutamate release, which causes destruction. And when they trigger inflammation, within the brain, they find that they changes structure and function in the brain in a way that's linked to depression and fatigue. Inflammatory markers are also increased in patients with PTSD and anxiety. Okay, if you look at these pathways here, at the top left there is tryptophan, which goes to 5-hydroxytryptophan and then eventually goes to serotonin. However, if there's inflammatory chemicals like TNF alpha, interleukin 6, and so on, then tryptophan doesn't go to 5-hydroxytryptophan and become serotonin. It goes to kynurenine, and kynurenine production is associated with damage to the nervous system. It's linked to Alzheimer's disease. It's linked to depression. Kynurenine is also associated with tics. And then eventually it's turned into quinolinic acid, which is associated with neurotoxicity. And quinolinic acid can lead to cell death and damage in the nervous system. It increases glutamate release. It causes lipid peroxidation and potentiation of other excitotoxins. So if you got inflammation, you're going to damage the central nervous system, and you're going to create depression, you're going to create anxiety, you're going to create cognitive problems. And that needs to be dealt with. Propping the whole system up by increasing serotonin isn't going to work. And here's one study that looked at SSRIs in the microbiome. Most of the serotonin in the body is produced in the gut. Unfortunately, SSRIs affect the enteric neurons and they disrupt the microbiome. So they're actually making the whole situation worse, which is common in pharmaceuticals. Subclinical vitamin deficiency is something that modern medicine simply doesn't look at, probably because nutrients aren't patentable. But if you think about it, if someone's eating an inflammatory diet, they're probably short on nutrients. They're messing with their absorption of nutrients. So subclinical vitamin deficiency can play a role in depression. Vitamin B intake has been shown in some studies to improve depression. Low levels of vitamin D are commonly found. Low levels of DHA in the frontal lobes linked to depression. Magnesium, and also we'll throw in exercise there. Older people, you'll see a lot of B12 deficiency. The absorption of B12 goes down as you age, and if you see an MCV in a CBC, you might notice that it's over 90. That is an indication of a B12 need. The combination of B6 and magnesium is often helpful. Once again, we're not treating depression with vitamins. We're treating the vitamin deficiency, but the vitamin deficiency can contribute to the depression. Thiamine deficiency is probably a lot more common in this country than is generally believed. We don't think it's a problem because we put thiamine in our junk food, and the RDA is very low. It's like 1.5 milligrams, somewhere in there. And we don't get much thiamine. I would make the argument that we need much more of it. When they look for thiamine deficiency, when they test for it in people that have depression, memory, and cognition problems, they find it more than you would think. It's 30% of psychiatry patients have that. And thiamine supplementation has been shown to improve both depression and anxiety, and there's some studies there that support that. If I mention lithium, most people think of lithium carbonate, which is given in very high doses for people with bipolar disorder. This is not what we're talking about. We're talking about lithium in small amounts as a trace mineral and also given as an orotate. And it's found that they study that if it's found in the drinking water, there's less issues with substance abuse, there's less arrests for violence and things like that. And it turns out that lithium is neuroprotective and it supports the brain and nervous system, mood, and behavior. The authors of one study suggested putting trace amounts of lithium in our food to cut down on societal violence. Lithium levels are inversely associated to aggression, suicidal, and homicidal violence. And there's some of the studies. It's been extensively studied and is useful as a trace nutrient. I highly recommend it. I've had patients where they're fighting with depression and anxiety and give them a little bit of lithium orotate, and it makes such a difference. And there is a gut-brain connection. They found that prebiotics and probiotics, when supplemented, help with depression. Of course, if you have to keep taking them, that means the environment isn't so great down there, and that's very often a dietary issue. Um, the gut microbiome in depressed patients is very different from those who are not depressed. And there's some of the studies that support that. And this is a slide from Microbiome Labs that shows how leaky gut or intestinal permeability can lead to inflammation. Microbiome Labs has a lot of good educational material. You should check out their website. And hypothyroidism is a strong cause of depression, and we miss a lot of it. The labs are not adequate. They usually only do a TSH, and the normals for TSH are too high. So you should ask about other hypothyroid symptoms with them. Also, if they have thyroid antibodies, there's a bigger tendency for depression. But this is something to rule out. I over the years have seen people that were on antidepressants and really should have been on thyroid meds. And hypothalamic pituitary adrenal axis has a role in depression. Stress and depression are very strongly linked. Chronic stress, there's a hyper secretion of cortisol, which you would think would stop inflammation, but it creates a downregulation of glucocorticoid receptors and ultimately increases inflammation. And the increase in inflammatory byproducts further damages the glucocorticoid receptors. So you see a lot of what we quote unquote hyperadrenia in patients who are depressed. And here's a study, there's further evidence. If they use the dexamethasone suppression test, the patients have an atypical response, and it shows that they are also hypersecreting cortisol, and there's a link to major depression there. Now we'll talk about anxiety a little bit. Daily worrying for 6 months or more may signal generalized anxiety disorder. It affects nearly 7 million Americans. 15 million Americans have social anxiety disorder, and 6 million have panic disorder, and 7.7 million have PTSD. And similarly, stress will lead to the release of cortisol, which can cause depression, but it also can cause anxiety. And it's the same sort of mechanism. You increase cortisol, but it binds to the glucocorticoid receptors, and which it causes further inflammation again. So stress and inflammation are linked. So this hypersecretion of cortisol and the downregulation of glucocorticoid receptors makes the pituitary think there's not enough cortisol. This ultimately leads to an increase of activity in the sympathetic nervous system and the dysfunction of the hypothalamic pituitary axis. It's linked to anxiety and inflammation. So you got to get stress under control and do something about the cortisol. And here's some of the studies that show this. If you can email me and I'll send you the list. So, of course, in our world, when we're talking about the excess production of cortisol, we use the term hyperadrenia. There's a number of adaptogens and supplements that help with that. Phosphatidylserine helps with memory and cognition. Ashwagandha has anti-stress and anti-anxiety activity, and even helps with sleep quality. Rhodiola can help reduce stress, improve fatigue, and improve mood. Lots of studies supporting this. Magnolia bark's another one. So Zorex, for the previous slide, makes a product called H80 Hyper, which is for hyperadrenia. It has the constituents we mentioned in the last slide. This is a representation of what happens to the body when it's under stress. Head full, and shoulders rounded, head forward. Heart rate increases, blood pressure increases, blood sugar increases, calves and buttocks tighten. So you get upper back pain, lower back pain, a lot of structural things going on. Zorex has created a product called Sympathetic Balance. These are for people that are wound up like this, and it's nutrients that support the sympathetic nervous system, help calm things down. There's a lot of B vitamins in it, methylfolate and B12 and pantothenol, a lot of B vitamins, and of course magnesium. These are nutrients that help physically support. Also good for the cardiac implications of stress. And here are the studies. I actually have a lot of this material in print. If you email me, I'll get it to you. Lots of studies supporting the sympathetic nervous system and the adrenals. And just like with depression, inflammation and anxiety are linked. And you want to get inflammation down. 35% of all your patients, or Americans in general, are in an inflammatory state. So B vitamins in general help mitigate stress. And supplement always was a basic thing. If someone's under a lot of stress, they've got depression and whatnot, give them B vitamins to get the inflammation out. That's almost like a knee-jerk thing that you could do. Folate's required for production of dopamine, epinephrine, and norepinephrine. So if you're low on folates, you're going to tend to be depressed. You're going to tend to have anxiety. And we threw this in stress. And of course, for anxiety, they use serotonin norepinephrine reuptake inhibitors, or SNRIs. They are used to treat both depression and anxiety. Sometimes they're prescribed for people with chronic pain. They work by reducing the brain's reabsorption of serotonin and norepinephrine, and there's several of them. These also affect the microbiome in a negative way. And according to the British Medical Journal, they're also linked to violence, lots of side effects, agitation, nausea, vomiting, stomach ache, indigestion, loss of appetite, diarrhea, constipation, dizziness, difficulty sleeping, fatigue, headache, low libido, and difficulty achieving orgasm. In general, the psych meds give you problems with libido in your sex life. And of course, the benzodiazepines are used not so much for general anxiety anymore. They don't like to get people on them because they are addictive. A lot of times, people with trouble sleeping will take these. They become less effective over time, and they're addictive. But the idea behind them is just like the SSRIs increase serotonin, these are made to increase GABA. And like all medications, they have side effects, memory problems, behavioral changes, delirium. There's dependence risk, of course, drowsiness, confusion, number of side effects with these. If you can find another way to get anxiety under control or help people with sleep, it's good if you can do that. And if they have been taking them regularly, withdrawal is often a problem. They are addictive. And there's a host of side effects for getting off these drugs too. Once again, you probably got to get someone with a medical license to help you with this. A number of years ago, Wally Schmidt put together a seminar and was talking about anxiety and GABA in general, and made the point that GABA is from alpha-ketoglutarate, which is produced by the Krebs cycle, and he had an involved muscle testing way of checking to see if the Krebs cycle was working. And for the Krebs cycle, it's mostly about B vitamins and magnesium as cofactors for all the steps in there. And a lot of times you'll find this why magnesium and B vitamins often helps people with anxiety. He had an interesting test of that. He would find a weak muscle and have the person breathe in and out of a paper bag, which used to be the old thing for panic attacks. Because you get a lot of extra carbon dioxide there. And his argument was the Krebs cycle was a source of carbon dioxide. And if carbon dioxide made you strong, you needed to improve the function of the Krebs cycle with various B vitamins and magnesium, and that would help with anxiety. Some companies make GABA. Zorex is one of them, and you can actually take GABA. You want to not give it if they got PKU or other amino acid disorders. You probably don't want to give them that. But that's a way of getting anxiety under control. But there might be issues there too. I want to talk about something here that's a little bit of controversy. Years and years ago, it was determined that GABA doesn't get through the blood-brain barrier. They're finding out that now that some does, but a number of practitioners have made the argument that if someone takes GABA and they feel wonderful with it, they might have leaky brain, and there aren't any tests for that. There's a book called "Why Isn't My Brain Working" by Dr. Dadis Karazian, and there's a number of nutrients they mentions in there: B vitamins, lipoic acid, resveratrol. Make sure they're getting enough sleep. Berberine. He talks about this in depth about actually fixing leaky brain. And if you suspect that, okay, patient takes GABA, they feel better with the GABA, gets rid of their anxiety and whatnot. Do they have leaky brain? That's controversial, but I felt like I needed to present that information to you, and you might look up that book. If you get a chance, go on YouTube, find Dr. Kelly Lambert, and look at her talk on neuroplasticity. That's its own discussion and it's worth doing. But basically, it's about making the brain work better and getting rid of anxiety and depression by building more neural pathways. And something as simple as knitting, you have an activity and you get a result and a reward from it. That increases the brain function. You see, we do a lot of sitting. We watch television. We stream things. Back in the 1930s, when the television became an idea, the New York Times said no one will have time to sit and watch TV because people were involved in activities, which now they're not, and we're seeing more depression. Find the video, Dr. Kelly Lambert. It'll really give you some insight on how to help your patients with depression. And here's some of the footnotes on GABA and on neuroplasticity. Once again, contact me, email me, I'll get you a copy. I just thought I would throw this up there. This is the pathways to produce norepinephrine and serotonin. You'll see that niacin, folate, B6, vitamin C, copper are all necessary. Once again, if there's nutrient deficiencies, you'll have a problem. The other thing is getting the actual amino acid, getting tyrosine and getting tryptophan. People with poor digestion, if they're not making enough hydrochloric acid, they're not getting their amino acids, that might be an issue too. And how to help these patients start with the roadmap to health diet. I've actually gotten a lot of people off of their antidepressants simply by changing their diet. People, their doctors, no one makes a connection between inflammation and these problems. Also micronutrients, so that can help them. You can also supplement lithium orotate one a day. I've had a number of people that was enough to kind of put them over the edge and help them. B vitamins in general, use a B complex, sometimes extra B6. I commonly use CGF, which is for blood sugar issues, but it's a good multiple and it's high in B vitamins, and I've used that a number of times. Adrenal adaptogens, the AD hyper from Zorex is also useful. And then get them doing things. If they sit around and watch TV and stuff like that, get them to do a hobby or an activity. It's meditative. It increases neural connections and will help them a great deal. And of course, Goodhart always said, "Fix what you find." None of these are treatment for depression. You're using the depression as saying, okay, what's this body need? Does it need thyroid support? Does it need adrenal support? Does it need B vitamins? Have they been eating a lot of junk? Do they need thiamine? So on and so forth. Similarly, if they're not producing enough HCl, if they got a leaky gut or dysbiosis, a lot of times that's the cause of the inflammation and the problem. Magnesium, number of studies have shown magnesium to be useful. Pancreatic enzymes on an empty stomach reduce inflammation. Do they need thyroid support? Does GABA help them? So, it's detective work at this point. Once again, you're not treating depression or anxiety, you're using that. The symptom is kind of leading you to what the body needs. Because we don't treat depression, we treat people with depression. Okay, and our next group of slides will be on high blood pressure, number 13. Hope to see you there. Okay, and thank you for listening. If you need any help with your practice, you need notes, you need any information, I've got patient education material. There's my email. There's Zorex's number. If you do start ordering from them, your new client, if you use the code PV10, they'll give you free shipping on your first order. Thank you.